you very much, Vicki. Hi. Hang on a second here. Vicki, but for some reason, not able to. There we go. You're here today for the seminar. It is on complying with OSHA record-keeping requirements, making your program bulletproof. What I'm going to be discussing today is going through the OSHA record-keeping, trying to provide you guidance and knowledge as to ensure that what you're doing is correct to prevent a problem with any violations that there might be relative to record-keeping, the importance of record-keeping, and why they have to be accurate. I'll go over some of the common mistakes, go over some of the interpretations, show you where some of the information is available off the OSHA website, and how to basically to try to avoid any issues relating to record keeping, make sure you're correct. I will do a quick review of, in 2017, every year OSHA updates and provides a listing of the top most frequently cited violations that they have noted for the previous calendar year or fiscal year. This is the 2017. Shortly in October or November, they'll probably be publishing one for 2018, which was from October 1st, 2017 through the end of September of this year. And go over those 10 and tell you the importance of why you should look at those and identify from a point of view, from a safety issues and problem hazards, look at those and identify because they could be important and relative to your sites as well. I'll also provide some conclusions, just some basics on some general things that I would suggest for good, effective safety programs, things that you need to do from a record keeping, from an OSHA, from medical surveillance and whatever else, plus also what you should be looking at relative to a effective safety program. Now, to begin, the real question is, what is the purpose of OSHA record keeping? Well, the purpose of OSHA record keeping is, of course, to require you to report, to collect, and capture, and to report the total number of workplace injuries that you sustained for the calendar year, the nature of the injuries, whether they were lost work days, fatality, restricted workday cases, job transfer, or whatever else, and also to identify a certain classification of illnesses, hearing loss, skin disease, respiratory disease, if that was the case with an illness, and check that off, and if it resulted in any lost work days, days away, and that's basically what you're looking at. Now, one of the things you have to note when you're recording or reporting a related injury, now this is something different than the original record-keeping requirement. When you do report that, in many cases, you may not be in violation of an OSHA rule. And I'll explain that shortly. And this is one of the big points of the OSHA, make sure you correctly and capture all injuries. And this is that there does not have to be a hazardous condition for an injury to occur. It goes back to the geography of where the injury occurred, the presumption of geography, and if the person was doing something in a work-related aspect and he was hurt because he slipped and fell for no fault and resulted in an injury, it's recordable. And I'll go through that. And keep in mind that OSHA injury and illness record keeping is completely independent of workers' compensation. They have nothing to do with each other. Many cases you may have something that's a workers' comp claim that may not be that you would not have as a OSHA recordable. I'll explain there are some cases where under certain circumstances it could be an OSHA recordable, but it would not be recordable as an OSHA case, but it may be workers' comp. So I'll go through that as well. Now, one of the important things to know, presence and purpose of record keeping, is also who are the covered employees. Basically, it covers almost every employer in general industry and construction, maritime, across the United States. All employers are required. There are some of the employers in the areas of service organizations and other types of systems that may not require it, but again, they may be exempt from record keeping. But you still have the requirement to, if that you're exempt from maintaining records, that's generally in less than 10 or less employees. You're in an NAIC code that is exempt. In some cases, you don't have to report to do the OSHA log, but you still have to go through if a fatality occurs or significant injury occurs, and I'll go through these briefly, still have to report them to the OSHA office headquarters or regional office or area office and possibly have a cite and have a violation. Covered employees must record each fatality, injury, or illness that occurs in the workplace. If it's work-related, if it's a new case, and it meets a certain particular criteria of the OSHA record-keeping requirements. Now, the question is, what employee and employer work relationships must you capture and collect? Well, in the case here where what you're looking at is the employee is any person who is on the company payroll, whether as a laborer, executive, hourly employee, a full-time salary employee, part-time, or seasonal worker. That is on the full-time payroll or payroll of the company that you are hiring directly. It could also be a person who you are bringing in who is not on your company payroll through a staffing service, but who is taking direct supervision from your company's management, other employees, and directing him in what he does on a daily basis. That individual is considered as a temporary employee and as such is covered because of your supervision of him. He would be covered as your employee, and if he was injured on the job site, he's going to go in your OSHA log. Excluded employees are going to be independent contractors. What's the difference between an independent contractor and a temporary contractor, temporary employee to a staffing agency? The difference is, in this case here, is an independent contractor may be a plumbing contractor, electrician, cement person. And can I just put this on mute for 2 seconds? Hang on 1 second. Sorry. All right, sorry about that. I just had a brief, I apologize. These are employees who you are hiring. They may be XYZ Plumbing. They are providing 2 people to come on to the site to do some work. You give them a contract, you give them a work order, but you are not designating the method and means as to how they do the work. You are not overseeing and supervising. I should say, you may be overseeing to make sure that they've completed the work correctly or done in a satisfactory fashion, but you are not telling them how to do the work. That is being done through his company and his supervision. In many cases, for large contractors coming on site, they have their own safety person on site, they have their own management staff, supervision, who are directly overseeing the contractor's employees. They would, any injury occurring to those employees are the responsibility of the contractor. OSHA injury and illness record keeping. Determination of case recordability. This is the beginning of it to make sure that you capture every case correctly. Go through this process. Again, ask the questions. Did the employee experience an injury or an illness? Is the injury or illness work-related? Is the injury or illness a new case? What is a new case? I'll discuss that. Does the injury or illness meet the criteria for a recordable case? And is it applicable to the specific cases? And if you get answers to each one of these questions, the answer is the case is going to be recordable. Looking at these questions, there's a couple of different ways. You can look at this flow chart here, OSHA recordability flow chart, which essentially does the same thing that I just said. Goes through it question by question. Or you could look at this form. This might be a little bit easier to look at. And you could look at it from this point of view, go through it, and wherever you're coming up with a yes, you go to the next step. In this case here, employee reports an injury or illness. The question is, does it result from a work accident or exposure in the work environment? The answer is yes. Has it resulted in death? No. But, or if it's yes, go in the head there, or is it an occupational hearing loss? Does it involve the following? Loss of consciousness, days off work, restricted. Does it meet the criteria of, is it a medical case? Going through that to verify whether or not it is in fact recordable, and we'll go through each one of those steps. The first step is to make sure when somebody comes into the nurse's station, goes to the supervisor, says, I got hurt, I sniffed some chemicals, I got lightheaded. Is it an injury or an illness? According to Bureau of Labor Statistics and also according to OSHA 1904.46, which is the definition, an injury or illness is an abnormal condition or disorder. Injuries can include cases as cuts, fractures, sprains. Illnesses, both acute, which a person sniffs something, gets exposed to a chemical agent, and has an immediate effect, or chronic, from long-term exposure to a chemical. They start getting health effects, problems associated with it, allergic responses to chemicals because of the continual exposure. Now that becomes a chronic case. And illnesses, but not limited to skin diseases, respiratory disorders, or poisonings. All right? Now, the question is, once you make a determination, number one, that it is an injury or illness that occurred, is make the determination of whether or not it's work-related. And to make determination of work-related, look at 1904.5. And it's presumed any illness or injury that occurs on the job site is considered work-related if it occurs as a result of some actions or activity taking place in the work environment. And if that's the case, then you have to look at it and find out there are several exceptions that OSHA has as to recordability of a case that occurs in the work environment as to whether or not it is or is not recordable. More importantly, a case is presumed work-related if and only if the event or exposure in the work environment is a discernible cause of the injury or illness. Now, keep in mind what I said before. It doesn't necessarily mean that there has to be a hazardous condition present. It does not, and I'll explain that momentarily. Or if the case is a significant aggravation to a pre-existing condition. An individual may have a back problem, unrelated to work, but due to some activities on the job, he has aggravated it. Now that turns it over to a work-related injury. Again, there may be some exceptions to injuries or illnesses relating to this, but again, you need to be careful, and I'll instruct as to the information you get to make sure you record it appropriately, or you have evidence and what you need to do if you believe that it's unrelated to work environment. The person came into work that day with the problem, and as soon as he comes into work, it's not uncommon, the person says, within 5 minutes, I just went to pick up this object, pulled my back out, I'm in pain. He may have come into work in that condition, and to investigate that. And the work event or exposure need only be of the discernible causes and need not be the sole or predominant cause of the injury. Now, the work environment is defined as the establishment and other locations where one or more employees are working or present as a condition of employment. It not only includes the physical locations, but of course it includes all the equipment used by the employees during their course of work. And remember, the presumption of geography, and this was a change in the record keeping when it was put in 2001, which has great ramifications. Unless otherwise exempted, OSHA looks at any and all injuries that occur in the workplace as no fault on recordability. So again, there does not have to be a discernible hazard present. And again, I'll explain that. But there are some cases where under exemptions, that may not be the situation, the case. All right? These are looking at exemptions, geographic presumption. And like I mentioned before, an injury is presumed to be work-related if it results from an event occurring in the work environment, unless accepted. And in this case here, you have employees who are supervisors go into in case one, they go into the change room at the end of the day, or the tray, whatever, and they get into an argument. They're in the change room. They still are on shifts. They get into a fight. Injuries occur requiring medical treatment. Are these cases recordable? The answer is yes, because even though there was no hazardous condition, you had two employees on the workplace getting into an argument, a violence activity, hurting each other. Because of presumption of geography, it occurred on your site. It is now recordable, and this is not exempted. Case two is a situation where an employee is walking from point A to point B. Person could be a person working in the office, walking to a copy machine. He could be a supervisor walking from the office over to a piece of equipment and to talk to some operators. He walks there, there's a clear path, no problems, no slips, but for some reason, he missteps in his walking, and all of a sudden, that either person going to the copy machine or just walking to a piece of equipment trips or steps, and all of a sudden his knee buckles, and it's identified that he has now torn a ligament, torn an ACL, PCL, or whatever else has occurred, and now question is this work-related? The answer is yes, regardless of the fact of what he was doing. His travel was for work, and the presumption of geography, being that he's on the job, the injury occurs as a result, it is a recordable case. All right? So keep that in mind. That's the main difference. If a situation event occurs, also I bring up here, and this could also include the parking lot, and it all dependent upon who is responsible for maintaining the parking lot. If you are the owner of the property and you are maintaining the parking lot, any slip, trip, fall that occurs within the parking lot that is not involved with a vehicle is work-related. If you are leasing property and the property is being maintained by the property owner, and person slips, trips, and falls, the same accident that occurs when you are in control of the parking lot and maintaining it and fixing it and doing everything else, under those circumstances, the case will not be recordable if it's under a lease agreement. Okay? Exceptions to geographic presumption. All right? Injury or illness involves signs or symptoms at work, but would solely result from a non-work-related event or exposure that occurs outside the work environment. A person comes into work, spontaneous nosebleed, they just walk on the property, they come in, it's not work-related at that point. You stop it, the person goes back to work. What if it occurs while the person's on the shop floor? There may be some dust or whatever else. Whether or not it is, in this case here, it could be construed that the person's breathing the plant air, now the nosebleed starts, it becomes work-related. There may be situations where a pre-existing medical condition that you can't control and the employee is on medication, that these events occur, that you could probably argue the fact that it's not a work-related case. But if it's a situation that occurs spontaneous and there's no indication of a pre-existing medical condition or the individual is under medical care treatment, and there is no exposure, nothing that occurred, you could do an exemption on that and document that as to why that case is not recordable. Other exemptions, all right? Injury or illness is solely the result of an employee eating, drinking, or preparing food or drink for personal consumption, brought on the employer's premises or brought in, whether it's brought on the employer's premises or brought in. I cite some examples. Person goes and heats up his food in the microwave, takes the food out of the microwave, it's hot, burns his finger, results in needing some first aid or medical treatment. Because it was his personal food, it's not recordable. Person goes in and one of his coworkers is running late and says, "Can you heat my food up? I'm running a couple minutes late," and just bring it to the table. He goes over, it's not his food, it's one of his coworkers' food, his lunches, heats it up in the microwave, burns his finger, requiring medical treatment. It now is, because it occurred on the job site, it is work-related. It is an OSHA recordable. The injury or illness is solely the result of an employee doing personal tasks unrelated to their employment. And it's performed outside of the employee's assigned working hours. Employee is solely, the injury or illness is solely the result of personal grooming, self-medication for a non-work-related condition, or intentionally self-inflicted. The injury or illness is caused by a motor vehicle accident and occurs on a company parking lot or company access road while the employee is commuting to or from work. The illness is a common cold or flu or other type of common disease that is being passed on. Again, I mean, these are the things that you have to look at. It is not work-related. There is exception to that. In some cases, it could be in medical profession. There are cases where a person gets exposed on the job to bacteria, HIV, hepatitis, as a result of doing the work through a blood stick or whatever else. Those would be recordable. But in general, standard types of viruses and illnesses that occur from common or diseases that are being spread to the general population just by routine exposure would not be. An illness is not a mental illness, is not considered as recordable unless a doctor or psychologist, psychiatrist documents and provides medical judgment that it is based on stress or some conditions in the workplace that cause the individual to sustain this issue. Again, primarily you're looking at a stress-related disease, high anxiety, or whatever else. Something may have occurred in the workplace that has caused him to become unable to work or become somewhat injured as a result and needs medication or some other guidance for taking time off from work until he recovers from that issue. But again, only if a doctor signs off on that. In a situation like this is an injury or illness scenario. Employee donates blood at a employer-sponsored blood drive, and he passes out. Now again, this is a voluntary activity. Is it recordable or is it not recordable? In this case here, because it is a voluntary activity, it's not recordable. So you have a fitness center on site, you have wellness programs, stretching exercises that you provide the employees or whatever else, or you have recreational activities which or physical examinations or whatever else, which you don't require the employee to take, but you offer this, and it's not required, it's not recordable. But if you require the employee to participate, and in some cases, like in hospitals, it's now required to take the flu shot. It's required to take hepatitis shots. Employees don't have an option. That's the requirement to protect the hospital, and to these types of diseases. Something happens, it becomes recordable. But your employer offers a flu clinic. You don't have to participate. You go in voluntarily, you take the flu shot, get sick, it's not recordable. You go to like I said, this could be a recreational activity, a picnic, and the employee says, it's a team building, you have to participate. You don't have a choice. An injury occurs during that activity because you say it's mandatory to participate. It's mandatory. And it's now work-related, whether it happens on the job site or not. It's at a company-sponsored event that the employee has to participate in. I'm not going to go over all these, but again, is talking about the work in the injury of a person in the parking lot. Is your injury or illness work-related? Company employee slips and falls in the parking lot, walking from his car into the front door. Is it work-related? Answer is yeah. If you control the parking lot, does there have to be a physical abnormality, a hazard? No. He can trip on a little stone that's sitting there. He can trip on a branch, and it causes him to trip and fall. But if the parking lot is not under your direct control, it's not recordable. It belongs to a landlord, the owner of the property. And also, again, if the person is walking and gets struck by a vehicle, gets hurt, it's not recordable. I'll ask you a question to think about it, and I'll talk to you later concerning this. What would you do if you had a situation where an employee drove into the site? He was driving a truck that was elevated in height. He has a running board. He opens the door, and the person steps out on the running board, steps out, because he's about 2 feet above the surface of the parking lot. He slips because it's wet and falls to the ground and is injured. The question comes back, would this be a recordable case? My viewpoint is there was a hazard here. The hazard was the condition. He was at an excessive height, 2 feet or more, had to step out on a wet surface, and then slipped and fell from his truck. Truth of the matter is, OSHA has defined this through interpretation as saying, just because he slipped off his truck, the injury occurred because he struck the parking lot, and it's a recordable case. I strongly disagree with that, but that's their basis under the no fault. I think it's the problem with the truck that caused the problem, but again, they're arguing and saying, no, that's not. Recordability status. When are injuries relating to recordability reportable? Okay, an employee is on travel. When is an injury or an event occur? Recordable. Example, employees traveling from his home to New York City to do some work at a customer site. Okay, he drives to New York City, pulls his car up to the parking lot. All right, now, if something happened to that individual from the time he arrived at the site, he's driving in his vehicle while he's driving to the site, he gets in a car accident, it's recordable because he is operating the vehicle for company business to go from his office to another location. Once he gets to his home away from home, whether that's a hotel, an apartment, or some other company subsidized housing, once he gets there, once he's in the lobby checking in, going to the room, whatever else, that now it involves the parking lot of that. He is now at his home away from home. It is as if he went from his office to his home. It's not recordable. All right. So again, injury, illness while conducting business over dinner or other activities is another situation. All right. If the individual goes out for dinner to meet a customer, slips and falls, and gets hurt under those circumstances, and he's going to talk business, his walk from point A, from the hotel to the restaurant, would be considered as a work-related injury, because he's on company business. Now, if he was going out just to meet with the individual, just to talk to the person, to have some fun in an evening, to have a drink or two and just some dinner, but not do it for business reasons, under those circumstances, it's not recordable because it does not involve work activity. Travel status exceptions. The person detours for personal reasons, not work-related. He's driving from Pittsburgh to New York. He decides to drive on his way from Pittsburgh to New York. He's going to stop off in Lancaster, PA to go to a farmer's market. He has to get off his main route. Instead of being straight on the Pennsylvania Turnpike, he gets off his main route to go to Lancaster. It's involved in a car accident. That's not work-related because that detour was not required. That was for personal business. It involves non-business entertainment or meals. Slips, trips, and falls in the hotel room or property, including the parking lot of the hotel, are not considered as work-related. Injuries, illnesses, or fatalities when traveling out of the United States or U.S. protectorates or territories are not recordable because U.S. law is not in effect. So once he's at that country, if he's driving, taking an airplane from point A to point B in that country, it's not work-related because OSHA laws do not uphold. Driving does not hold. The record-keeping requirements do not apply in those situations. Like I said, unless it's a U.S. protectorate, yes. So that's another thing to keep in mind when you're doing record reporting. Working at home, injury occurring as a result of activity related to work, person in his home office, doorbell rings, FedEx is coming to deliver him some materials that he needs to do his job. He goes to the door, slips and falls, it's work related. Okay, what if it's UPS, FedEx comes to deliver something from Amazon, or Amazon's delivering? No, that's an exception because now that's personal. That's not work related. So that accident that occurs, it may be caused by the same problem. He's walking from point A to point B, but because he's getting something that's not work related, it's not an OSHA recordable. The same thing works in a hotel. Once the person's in his room, if he goes down to the front desk to pick up a fax or pick up something that was delivered for him, if that is not work, if that's work related, and something does happen at that point, that's the same thing as the person working from home gets hurt, it's work related. But if it's a personal package, it's not. Not going to go through all these, but these are some examples, and this is, like I said, with the injury, a person comes in on a Saturday to do some work, put some work together for use his computer, to do some work for his daughter's report. While on the site, he slips and falls and gets hurt. Recordable or not, it's not recordable. He is not required to be there. It's not a work day for him, and it's personal activity that he's doing. It's unrelated to his business, so it's not work related. On the other hand, an employee, in this case here, is on vacation, and he has a personal meeting to go to, personal appointment. On his way to the appointment, all of a sudden he has to use the rest facilities. He realizes, my office is 2 miles away. I'm going to stop. I can't make it another 20 miles. I'm just going to stop in my office. It's the easiest thing to do. Goes out, has to scan his card into the job site. And this is coming out of one of the OSHA, a letter of interpretation, essentially. He goes into the bathroom on the job site after logging in, checking in on a day that he was supposed to be at the office, goes, uses the restroom. As he walks out, he slips and falls on a wet floor and breaks his elbow. Is it work-related or not? According to the OSHA interpretation, it is work-related. The exemption doesn't hold. It's for the simple fact that he is not present in the building as a member of the general public. And since the building is secure, the only way for him to get to a restroom was to badge in, control access as if he was a full-time employee, which he was. And if he had just gone into if it was a restroom in the lobby without badging in, the answer would have been no. But being that he went in to use the restroom on one of the floors in the building or one of the other areas, the answer is yes, it is recordable. Is the injury a new case? What is a new case? A new case is an injury that occurs when a worker has never previously experienced a recorded injury of the same type that affects the body part, or when an individual experiences an injury that he may have reported previously and been under treatment for, but he has gone a period of time either without treatment, without medication, and without work restrictions, 30 days or greater. The case then would not be considered as a new case. It would not be considered as an old case. All right? What constitutes a new case? Is there a medical opinion regarding resolution of a case? The employer must follow that opinion. If he is discontinued with that and gone a period of 30 days or more again, it's not. If an exposure triggers the reoccurrence, it is a new case. All right, an exposure. People who have allergies, whether it could be a chemical allergy, and they get something on their skin. The first time they get that, it may not be a problem, but repetitively, when it occurs and it heals itself after a period of time, regardless of the fact, once the person is sensitized, it's a new case every time it occurs. If signs and symptoms recur even in the absence of exposure, it is not a new case. A person who has chronic disease, silicosis, tuberculosis, asbestosis, exposure to organic compounds or whatever else, and they have, like benzene, some liver problems, and they're monitoring it or whatever else, and there's flare-ups. It's all based on the chemical exposure. So in this case here, it is not a new case. All right? And that's important. There's two examples here. One is a person has a wrist injury, goes out, goes to the doctor, reports it. He's put on physical therapy. He's given a rigid wrist or splint. He's put on job restrictions, and he's given medication. All right? He comes back to work. Okay? He's there for 5 weeks after the original injury. He comes back to the nurses and says, and he's no longer taking any medication. He's no longer on physical therapy. He's no longer wearing the splint because the doctor says you don't need it anymore. He's completely recovered. After 5 weeks, again, he comes back to the nurse. It is now considered as a new case. On the other hand, if the person never was off medication, person continued to go to physical therapy, the person was still required to wear the splint, comes back in the doctor, even though he doesn't have the pain, comes back in and reports it, and there's exacerbation of the injury requiring now some medication to be given to him, physical therapy to be reestablished, it is now considered as an old case, and you just go back, instead of putting a new case in on the OSHA log, you can go back and update the information relative to the previous case. If there's additional restricted work days, if you add those to it. If there's days away from work, you add those to it. If in 3 weeks, the person, or 4 weeks, he's never been fully recovered, but he goes back on the shop floor, and as a result of the event or the exposure, he dies because of some subsequent exposure, it goes back to the original injury because, again, it is an old case, and you would update the information in the log. What is significant aggravation? Well, it's aggravation resulting in a significant aggravation when an event or exposure in the work environment results in any of the following: death, loss of consciousness, days away or restricted work activity, or medical treatment. It could be a pre-existing injury condition. And if that is the case, you at the plant can make a good judgment for it. If you make the determination that it's not, the person has this pre-existing condition, it's not work-related, I would say there you run a risk of not knowing if the individual was doing some physical activity at the time and he had that condition and it caused that aggravation. You may need to have a professional interpretation by sending the person out to a physician to make a determination whether or not what the person did would have caused an aggravating condition and caused that person to be injured as a result, and aggravating the condition now that becomes work-related. If the doctor says it's not the case, this individual has a chronic condition, and no matter what he does, it's going to occur, you can't prevent it. Or the activity did not cause this, you can argue the fact, and it would not be as a significant condition, aggravation. Situation here is the injury or illness and aggravation of a pre-existing condition. Individual slightly sprain their wrist, working at home. Okay, they come into work for several days, they don't have any impact. I mean, they're wearing the ace band, the joint, or a splint, or a support of some sort of the elbow wrist. But then he goes to pick up a 20, 30-pound box, and he does it, it slips. All of a sudden, he's now in severe pain, goes to see the nurse, and now she says, well, that injury, up until this point, all day long, he's been working without a problem. He goes to the doctor, he's diagnosed as having a severe tendinitis or some other type of injury to the wrist. Now it becomes a recordable case, and as a result, he has aggravated the condition, it becomes recordable. And again, in some cases, as I mentioned before, for record-keeping purposes, if you have questions, get them to a physician, let the physician make the determination. You don't have the full capability. And again, get them to a physician that you deal with. Once the person gets out and goes to his own physician who makes a determination and puts the person on some treatment, puts the person on medication, prescribes physical therapy, and the person goes there, and your doctor said he doesn't need it. Once the person has already gone that route and the initial diagnosis has been implemented and the prescription has been implemented, it becomes recordable. Again, like I said, I'm not going to go through all these, and I'm just going to pass on that. This one right here, you can look at these later. Criteria for recordability. They're very specific. Criteria for recordability is injury or illness resulting in the injured employee requiring medical treatment beyond routine first aid. Does he require to take days off of work? Is he prescribed work restrictions, limiting what type of activities he can perform? Has he received one or more dose of a prescription dosed medication? Whether it's over the counter at a prescription dose or he's taking a true prescription dose. There are some medications, for example, Motrin. You can take 2 Motrin over the counter. It's not considered as a prescriptive dose unless you take 3 or more pills, because there are prescription dosages for that amount that you cannot buy over the counter. That's greater than over the counter medication. significant diagnosed injuries, such as but not limited to cuts, lacerations, requiring application either of sutures or medical adhesives. Is that a recordable case? Yes. Okay. Any diagnosis of fractured, including fractured teeth, that result from an incident that occurs in the workplace makes it a recordable case. Any sprays that require medical treatment, first aid, medical treatment, prescription medication, wearing of rigid type splints, an ankle support, a knee brace. Person loses consciousness as a result of some at-work activities. And I'll cite an exemption that I looked at and said it is not the case, and when you can take a loss of consciousness and argue the fact that it's not recordable. And again, anytime you do this, make sure you document it in your file. Because when OSHA comes out and looks at your records and they see this report, you may have had, and it was initially looked at as whether or not it was OSHA recordable, and you said, no, it's not. We have an interpretation. Make sure you have it documented. Specify why, and I'll explain that in a few minutes. A punctured eardrum, illness, hearing loss, asbestosis, silicosis, persons having exposed lead toxicity, or have to be removed off the job and transferred as a result of having excessive blood lead levels. There's neurological impairment from exposure. He gets lightheaded, passes out, person dies, or there's an amputation or a loss of an eye, for example. That's another thing. What is medical treatment? Medical treatment is the management and care of a patient to combat disease or disorder. And for injury or illness, it does not include the following. It does not include a visit to a physician solely for observation or counseling. It does not include sending the person to a doctor, to a hospital, or the only thing that were done was diagnostic procedures, such as x-rays and blood tests. There's nothing else that was being done. These are solely for diagnoses. They could be eye drops to dilate the pupils to see if there's any foreign particle in the eye. These are considered as diagnostic. Any treatment contained in the definition of first aid. All wound closures, whether stitches or medical glues. Any injections of a medication, with the exception of tetanus, which is acceptable for if a person gets a cut, goes to the doctor, gets a tetanus vaccine, that's not considered as medical treatment. That's considered as acceptable practice to prevent if the individual had a case where they got cut with those stitches, giving him a tetanus shot is preventative. IV application of fluids. Not giving somebody a beverage glass filled with Gatorade to drink. Rather, giving him fluids through an intravenous IV for heat stress or other applications so that it prevents the issue and the problem relative to that, and is only something that a medical professional can do. The extraction of teeth or the repair of damaged teeth. Why is that considered medical treatment? Because only a licensed healthcare practitioner, basically dentist, dental surgeon, oral surgeon, will be able to do that kind of work. Removal of embedded particles from the eye. I'm not talking about a piece of dust that's on the eye surface. I'm talking about a piece of metal or a piece of dust that is actually in the eye that requires some numbing of the eye and use of instrumentation and equipment that only a licensed healthcare professional can perform. First aid is use of non-prescription medications and non-prescription dosages, tetanus immunizations, cleaning, flushing, or soaking surface wounds, wound coverings such as band-aids, butterflies, steri strips, Going back to the original record-keeping standard, steri strips and butterfly bandages were medical treatment. Why? At the time that the record-keeping standard went into effect, and it never was changed in 2001 when it changed, was butterfly bandages or steri strips available over the counter? Well, being that they were available over the counter, you didn't need to go to the hospital for those. So as a result, they now became first aid. Hot or cold therapy, routine icing and heat of a device system. Person strains their knee and they say daily, treat it with ice for the first 3 days and then put heat on it for 3 days afterwards. That's not medical treatment, that's first aid considered. Temporary immobilization devices used to transport accident victims to the hospital. Drilling of a fingernail or toenail to drain fluid from a blister. Or drilling or from under the fingernail. Wearing of an eye patch. Removing foreign bodies from the eye using irrigation or swabs, only taking it from the surface. Removing splinters or foreign material from areas other than the eye, in skin, splinters, whatever else, using tweezers, cotton swabs, or other simple means outside of having to have it cut by it with a scalpel and remove it, or some other device to get under the skin to physically remove it. Use of finger guards to protect a wound. It's only a protection, it's nothing more than a Band-Aid. Massages, and I'm talking about not therapeutic massages that would be given by a physical therapist as part of their treatment. This is going to be going to a massage therapist, massaging their neck to release tension or whatever else. There's no real medical condition. It's considered as just as standard first aid. And drinking fluids for the relief of heat stress. All right, so those are what we consider as non-first aid, first aid cases. What makes a case days away? What makes a case restricted? What makes a case job transfer? Again, the person for a days away case, restricted workday case, the first day after the accident occurs. Person gets injured on Thursday. He goes to the doctor. It could have been beginning of shift. He doesn't come back to work that day. Is that a lost workday case? No. Friday comes. Doctor says, take a few days off. Or the person wakes up in the morning not feeling good, calls off sick. The first day after becomes a lost workday case. Work restrictions. So like I said, the day of the injury does not count. Work restrictions. Person goes to the doctor gives them some restrictions saying, can't lift over 10 pounds, can't climb ladders, don't do this, don't do that. For a period of a week. Person comes into work, you have to eliminate that from his work tasks. All right. Days away, and the change is in the standard was these are cases or job transfers. Again, this could be a result of work restrictions because you can't eliminate these tasks from his normal job at a routine basis. They are activities that are not done, that are done day in and day out that you cannot take away from his job. So as a result, there's no way to satisfy it. He has to do that or he can't do the job. You count the change in this case here, making sure when you take a lost workday case, work restriction, it used to be at one time that if a person was injured on Friday and his schedule was not to come back to work till Monday, Saturday and Sunday would not be considered days where you would have work restrictions, lost work, or days of transfer time off the job. The question has to be asked, would the individual have been able to work if Saturday and Sunday he was scheduled? He would have been scheduled. Would he have been able to work? The answer is no. It begins that Saturday. He can't come back Sunday. He comes back Monday. You got 2 days of lost work. He reports back to work on Monday. Work restrictions. Individual again. Well, I'd be restricted on Saturday. I'd be restricted on Sunday. There's one difference, though, in this situation. If he comes back Monday and he's on the restrictions, it's a restricted case. But when you look at his script and what the limitations are, make sure you look at those limitations and match up with his job. The prescription from the doctor may say no lifting over 25 pounds. Individual only lifts maximum 10. It's not work-related. You don't have to accept it as a work-related case. The person's, all his normal tasks can be performed. And as I said, just mentioned before, if a task is not done on a weekly basis, it is not considered, and you could take that away. The person's supposed to be on work limitations for 2 weeks. You could eliminate that for a week, and it's only done once every 7 days, once a month, or once every 2 weeks, and it's not going to affect the individual who's only going to be on a 2-week limitation or 10 days. It's not work-related. It's not a restriction. And if a medical opinion exists, the employee must follow that opinion unless a second authoritative medical opinion is available that overrules and is more like I said, the answer is more authoritative. But if the individual already starts taking the medication, if the individual already has started the work restrictions, if the individual has another activities and they've already done it, once they've done what the initial diagnosis indicated, you still have to take, for the time period the person was on work restrictions, work days off of work, for the time that they worked until it was overruled by the second opinion. You still have to take that as a reportable case. Restricted work is activity exists, the employee is unable to perform their work he or she would otherwise have been scheduled to perform, or unable to perform one or more jobs, routine job functions. And again, it has to be something that is performed at least once per week. Restricted work is not recordable if the employee experiences minor musculoskeletal discomfort. All right, his neck's a little sore. The doctor says there's no limitations. You can go back to work. That's not considered as a work restriction. If he says you shouldn't be doing something, wouldn't be considered work restriction. A healthcare professional determines that the employee is fully able to perform all of his or her routine job functions, and the employee assigns a work restriction to that employee for the purpose of preventing a more serious condition from developing, would not be considered as a restricted work. If you decide to take the person off the job for a day or two, even though he was allowed to come back to work the next day and do his full functions, but you say as a policy, I'm going to bring this person back. I don't want him doing these activities. It's not, the doctor says he could do them. We're just going to eliminate these for a day or two. That's our choice. That's our decision. That's our policy and our programs. It's above and beyond what OSHA requires. We are incorporating that just to give him a few extra days to rest and relax. It's not work restrictions. And again, as I mentioned, review the work restrictions, because sometimes you're going to find that if you take them as is and say this is restricted work activity without looking at them in detail, once you've made that decision, he's on restricted work, he's on restricted work. If it doesn't meet that, the restrictions, he doesn't fall, like I mentioned, doctor says no lifting 25 pounds, he only lifts 10. You say these are not valid work restrictions. Document that, put it in the file stating that the individual is not on restricted work activity because he does not meet the criteria. His work does not require him to meet what was restricted. I'm going to just pass on this one here. These are things that you could look at later, but these are questions on some cases where internal work restrictions and activities may, in fact, in some cases, can be considered as causing work restrictions. For example, and these are cases where an individual gets hurt, gets cut, has an open wound, all right? Under most situations, the employee should be able to go back to work the following day. He has it bandaged up, it's fine. But in certain cases where the person might be doing work with hazardous chemicals, nuclear materials, and under those conditions you say, you know, we can't allow you with an open wound. You have to let that wound heal for several days before you can go back to your normal job. And even though you have it bandaged, until we know that it's fully closed to prevent any possible contamination, or until we get data back, indication that you don't have any contamination from a radiological point of view, because we're not going to get that back for a day or two from the analysis, you can't work that. That's considered to be work-related. And it would be considered as, even though it has policy, it doesn't meet the OSHA criteria, it's your policy, and in this case here, it's being mandated by a regulatory agency, the NRC, could be OSHA or whatever else. It is good practice to do that. All right? Job transfer, I discussed this. Significant diagnosis of an injury or illness. Anytime cancer is diagnosed, chronic irreversible disease, punctured eardrum, fractured or cracked bone or tooth, those are conditions that will automatically be diagnosed and recordable injuries. Any exposure to a bloodborne pathogen, whether or not the employee gets the disease or not, a needle stick, a splash in the eye, on the face, of skin, with a known pathogen would be considered as exposure and would require that to be recorded as a work-related incident. And it meets the general requirements of recordability, regardless of the fact of the individual, whether or not he gets the disease or not. I already answered this concerning differing medical opinions, and this is a letter of interpretation issued in 2011 about an employee going out to a doctor, getting his own physician, coming back with this note. He takes a couple of days, but before he comes back, he takes some days off. His office, his shop, his company calls him and says, "We need you to go see this physician." He's been off for a day. He goes to their physician. Physician says, "Based on my opinion, you don't need this treatment. You don't need this. This is the basis for it. I think it's unnecessary. It's uncalled for to do this." But once the individual has already started, it's recordable. Secondly, whose is more authoritative? Again, who is written with more scientific and basic backing. If it's your doctor that says, "Well, I don't think this person needs that, there's no justification for that," but his doctor says, and the x-rays and his diagnosis shows a problem, the more authoritative one will be who has the abundance of evidence to indicate the correct diagnosis. And that's what this letter of interpretation. So be careful. If you send your person, he goes to his physician, send them to your physician says it's inconsequential, I don't think he needs this, make sure they have good documentation and good evidence to say and justify why the initial diagnosis is incorrect. All right? Hearing loss, you meet the OSHA criteria, 25 dB over an absolute 0. Automatically when that occurs, there's a threshold shift. The person's hearing becomes recordable. And every time the person's 10 dB threshold shift occurs in the person's hearing, it becomes a new recordable case. Completion of the OSHA logs. All right. Looking at the completion of the OSHA logs, again, when you fill out the OSHA 300 log, you put a case number down. That's a case number or incident number that's specific to your location. The name of the employee, the date, a brief what the diagnosis was, what the incident was, the nature of the injury, how it occurred. If it was an injury, is it death? Was it lost workday, restricted, job transfer? Was it a workplace illness? Specifically, it identifies, was it a hearing loss? Is it a skin disease? Is it respiratory? There's two other ones on there as well, but does that case meet that, and check that off. If it required lost work days, work restrictions, you indicate that. But you have to make sure that each one of the items, each of these items for correctness, if OSHA looks at the form, and you don't have an incident identification number, you're missing a spot, that would be considered as an incomplete filling out of the form. You may be in violation. Incomplete, improper checking off of the nature of the event, whether it was an injury or illness and the specific type of illness that it was. The summary of the work-related injuries and illnesses. This is basically just taking your OSHA log, counting up the number of lost workday cases, days away for restricted workday cases, whatever it is. The total number of recordable cases, calculating your rates based on the hours, your illnesses, reporting that exactly what is on the OSHA log. And this gets posted beginning February 1st of the calendar year. So this year it would have been February 1st, 2018, and it's posted in a area of the plant where employees are going to commonly see it. It could be on any bulletin board in the main office area, on the shop floor, where employees will have, generally in areas where you'll have the OSHA sign posted, EEOC, putting it in an area like that where you make sure that people see this. You provide all the documentation relative to the nature of the site, what the site's name is, the NAIC code, National North American Industrial Classification System, in business code, the information relative to the address and whatever else, the total number of work hours. And then it comes down to the signature that a person from the site who would be a company executive has signed it and is documenting and agrees and certifying the validity of this information. He is attesting to the fact that it is correct and accurate. All right? You also need to fill out the OSHA Injury Illness Form 301 in some cases and make sure all this information is in there. Or in the OSHA situation, you can use other forms, could be your accident investigation form, whatever you have, that has the same information as long as it has the same basic information. It could be your first report of injury for workers' comp. It could include the same information. That would be acceptable. Like I said, your first report of injury of some sort in the plant, when it's being investigated, what happened, all that explanation, and it covers all the same information. It's acceptable. It doesn't have to be the Form 301. It just has to cover that information. All injuries, illnesses must be recorded on the OSHA log within 7 working days of the report of the incident. There are going to be times where a person may not come into work till the following week, 7 days later to report an accident and an injury. He may have hurt himself on Friday, gone on vacation, may have reported it, comes back on the following Monday, and he has an infection in his finger. It was documented that he was injured, or he has something else is being taken. Now it became what you thought was a non-recordable case, became recordable. So you have 7 days from that point to the time when you understand that it became recordable to get that entered. I mentioned about the equivalent forms. It doesn't have to be the OSHA 301. It doesn't have to be, you can use any form as long as it's comparative. The OSHA log has to have the same information in the same format. The certification, the 300A, which is the summary, has to be on the OSHA form. Forms can be maintained on a computer and can be electronically produced, just as long as you can get that. And remember that the summary of injuries and illnesses must be posted by February 1 of the calendar year and kept up until April 30th of that calendar year. You can keep it up all year if you want, but it has to be for at least from February 1st through April 30th. Reporting requirements, and ensure that you've made sure you've done this relative to certain types of catastrophes and events. Reporting. Report all fatalities within 8 hours of the fatality as it has occurred. Where to report it to? You can report it to your area office, the OSHA regional office, contact the OSHA national office, or go online and you can fill it out electronically and get that submitted within 8 hours of the death occurring, fatality occurring. Within 24 hours, you have to notify OSHA with a similar means with any work-related amputation, loss of an eye, or inpatient hospitalization of one or more employees within 24 hours. You no longer have to report highway or public street motor vehicle accidents outside of construction work zones, where you would have to report it. Generally in the past, you would have to file that as a fatality. It could be commercial airline, subway, train fatalities. After 2001, OSHA dropped that from the requirements because of issues that were beyond the control of the employer. You did not have to report those, and to OSHA would expect that. In some cases, when a person dies of a heart attack on the job, whether or not it's work-related, in many cases it's not going to be work-related, OSHA still wants notification. It's unlikely that they're going to do any follow-up on that. You give them the evidence, you give them the documentation reported, they may not. But if you tell them that the person was down working in extreme heat or whatever else, and he went and had a heart attack, in those situations, you probably, with a fatality or multiple hospitalization, amputations, or whatever else, will be getting a visit. For more help, these are some websites that you could look at. OSHA Recordkeeping page, OSHA Regional or National Office Recordkeeping Coordinators. Each one has it. You can contact. These are the locations where you can find that on the OSHA webpage. The interpretations. OSHA has interpretations for any letter, any question that has been raised. I went over a few of them, but again, when viewing, you need to be aware of these. If you go back to the OSHA standard, and these are questions that you can resolve maybe without calling OSHA and making sure that you've properly reported, properly taken credit for reported the injury or not. But these are things that you need to look at. So when reviewing, and then also remember, if you're on the OSHA webpage, looking at the OSHA standards, if you see any standard or any paragraph that is underlined, if you click on that underlined, that immediately takes you to all the letter about interpretation specific to that particular subject. And you'll get some good guidance for that. All right, so again, under WebEx, it's difficult to get to the letters of interpretation, but again, this will take you directly to that, okay? Next part of it, just quickly, I'm going to go over the areas where you had the most cited violations in fiscal year 2017. Just kind of go through these, and these are important for the simple fact, you have these in your workplace. You need to understand that these hazards exist. Look at them from your point of view for establishing proper programs. Try to catch, if you have issues, to correct them before you get the visitation by OSHA. Otherwise, you're going to get a citation. All right? Number one on the list, you have fall protection. All right? Now, again, these are basically, most of the citations that they cited here, for the most part, for number one, were construction related. But keep in mind, some of the same things you look at, even though you're not guided by the construction regulations of your general industry, you may have the same things, people working at height and not properly protected from fall situations. Remember, person's working 4 feet or over on a platform in the workplace. Is there requirements for fall protection? Yes. You need to look at what the requirements are and take a look at some of these things here. If it's for personal protective equipment, whatever is required, if you're going to put the people in fall protection, most cases in general industry, what's going to be required for construction, you're going to look at the same thing for general industry. People are working on scaffolds as well, so in general industry. Hazard communication, all right, is number 2. Over 4,700 violations of different OSHA form citation areas were reported. All right, you can look at it and find what specific sections were cited the most frequently and how many times. For example, 1910-1200, A7, employees shall develop, implement, and maintain at each workplace a written hazard communication program. Do you have one? If you do, make sure it covers the sections and information that is essential that the program is supposed to have. 1910-1200, employees shall provide employees with effective information and training on hazardous chemicals in the work area. At the time of their initial assignment or whenever a new chemical hazard the employees have not been previously trained about or is introduced in the workplace. How do you do that? Make sure people are provided that information. And again, remember, these are both to your direct hire employees and also to the temporary employees, have these same obligations. Look through these. 1910-1200, the employer shall maintain in the workplace copies of the required safety data sheets for each hazardous chemical and shall ensure they are accessible during each work shift. How do you provide that? Do you have hard copies? If you do, are they readily available if you're a 3-shift-a-day operation that anybody can go into that area and find them 24 hours a day? Or are they being maintained electrical system, electronically, on the computer, that everybody has access to go into and pull up the safety data sheet? Number 3 on the list is scaffolding. And again, I stress you're in general industry. Most of these are related to construction. Look at the same things. OSHA scaffolding requirements under general industry, you're using them. Try to meet these requirements. Look at these as well. Be ensured that you have things covered. If you have scaffolding, make sure they're built correctly. Make sure that somebody has observed and recorded that the scaffolding is built correctly. It's inspected on a routine basis. If there are problems with it, it's taken out of service. You're not letting people up there with improper fasteners, loose legs, or whatever else, the problems. So again, take a look at these things. Number 4 is respiratory protection. All right. Number 1 on the list is if you're using respirators, and there's 3,400 citations were issued. Number 1 on the list, you don't give a person a respirator, required use of the respirator, unless you have had that person medically qualified to wear the respirator. All right. So that's important, number 1. So if OSHA comes into your site, looks at what you have, or you have people who are required to wear respirators, and you're walking through, ask the employee, have you been medically trained? Or, I never saw you wearing a respirator before. He says, oh, my boss gave me this the other day. Did you get a medical surveillance? Or get assessed as it whether or not you were qualified to wear a respirator? He says, no, you're in violation. You have a written program that meets the OSHA requirements, and so forth. These are things that you're looking at. Have you given people respirators who requested them to be used on a voluntary basis? If you do, have you provided them the adequate documentation? You can give a person who's asking for a respirator who voluntarily wants to use it, doesn't need it, it's not required, giving him a single-use respirator, one of the dust masks, dust humor mist masks, the P90s, P95, whatever you want. Those are single-use respirators, and giving him Appendix D of the OSHA rule, which basically identifies what a voluntary use of the respirator requires, what is necessary, and giving him that information and documenting that information. Number 5, lockout tagout. Basically, number 1, make sure you have an effective lockout tagout written program. You've trained the people. If you have particular machinery that requires specific procedures to lock and tag it out, that they are written and it's documented. What do you do and how do you document de-energization of the device? These are all the records that you need to maintain. It's a record-keeping program and also a verification of the employee's understanding of the requirements of the standard and what your programs are. In too many cases, people are not aware of lockout tagout. They get injured. This happens to a lot of temporary employees. They come on the job the first day, they get injured. Were never informed of the lockout tagout. Got crushed, got caught between two parts, had amputations. These are required to be anybody who operates the machinery. So again, look at your lockout tagout program. Ladders, are they inspected? Again, these are general, this is a lot of construction, but ladders are very prevalent within general industry. Are they inspected? Are ladders that are damaged taken out of service? Are people aware of the limitations of the use of certain types of ladders? How to use a ladder safely? And these are what you're looking at here. Powered industrial trucks. Basically, the biggest one thing here is, has the personnel operating these vehicles been trained, received adequate training and certified that they are qualified to operate the powered industrial vehicles, whether they're forklifts, JLG lifts, scissor lifts, whatever you want to call it, make sure that they are. Have you conducted at least once every 3 years some performance evaluation to make sure the person still understands and renews their certifications? Are the units equipment inspected on a routine basis? Is it inspected by the operator before daily use? Is it inspected on a quarterly basis or monthly by maintenance? Does it go through an annual inspection check by some third party outside who comes in and does a thorough assessment of it? These are all things that need to be looked at. And again, if the machine has some problems that should not be operated, the brakes are not working properly, the lift, the hydraulics don't work, will slip, it comes out of service, it doesn't get put in service until it is repaired. It gets tagged out. Number 8 is machine guarding. And again, any and all machinery that has moving parts, you need to assess and look at whether or not you need machine guarding. Whether or not any open access points to prevent the person from putting their hand in while the machine is operating. That there's mechanical systems, automatic systems, interlock systems, guide beams, electric light beams, or whatever else, that if the person gets inside of a device, gets their hand in that area, it shuts down because of the detection of the beam has been broken, or interlock has not been overridden. Again, these are things that need to be looked at. If you got blades on things, again, if it's a fan blade, is it adequately protected? Is it guarded so that a person cannot stick their finger in there? These are the things that you need to look at. And again, these are standard programs, and these are the primary OSHA violations. Fall protection training requirements. Again, going back to number 1, anybody wearing fall protection needs to be trained, whether or not it's on construction, whether it's in general industry. Knowing how to use that equipment, knowing what the limitations are, knowing that if they're going to be 10 feet above the ground, that they shouldn't be wearing a lanyard that's 20 feet, knowing where to tie off, as an anchor point. What makes a satisfactory anchor point? These are things that are necessary, the training that they've gone through this. And 10 is electric wiring methods. And again, this is 1910-305, and this affects both general industry as well as construction, but making sure that fixed wiring is proper, that you have GFCIs on equipment, that you have the breakers will trip with certain conditions. You can't overload, and whatever else. Take a look through these things. These are the ones that are common. Identify, go back to the OSHA standards. So these are the 10 most frequent violations that were cited, or areas that were cited in 2010. To finish up my presentation, just very briefly kind of go over some injury, illness, prevention, and case management and reporting requirements and good practice, what I would suggest. I recommend for record keeping and accuracy and maintaining effective is establishing an early intervention program of injuries, and that is trying to get a report of injuries as quickly as the injury occurs. Have a set program. The quicker you get intervened with the injury, you may prevent an injury from becoming a recordable case or a lost time case. Some situations, a person may have a case where they cut their finger, all right? They don't go to medical. 3 days later, they don't report it, or they do report it to supervisor, but again, supervisor doesn't send them to medical. 3 days later, person comes in, his finger's swollen, signs of infection. If he had gone to first aid, they had happened, the wound would have been cleaned, bandaged, it didn't require stitches or medication. Now you have a recordable case. And companies need to establish policies and procedures that require the reporting of all incidents, whether an injury, however minor, may or may not have occurred. Identify that, require that. That's all part of the early intervention, all right? Get reporting of what we call incidents that can lead to corrective actions, such as events that do not result in any injuries or illnesses or damage to property, but these are considered as what we call near misses or near hits. It means something occurred that if a person had been in that area or certain conditions existed, you could have had a serious event occur. And these, in many cases, occur before you have an injury or illness occurring. Perform risk assessments to identify the workplace hazard. Go out, take those 10 OSHA key frequent citations, areas of citations, and see what has been done. What citations, what areas do you comply with? Look at those and try to identify what you've done if you have those problems. And if you do, these are areas that need to be addressed. When you do a risk assessment, you look at what is the risk of the hazard occurring. Is it something that's going to occur infrequently? What is the most severe type of injury that will occur? Is it going to cause death? Is it going to cause amputation? Serious injury where the person's going to require hospitalization, long time recovery before the individual returns to work, if they can return to work? Or is it something that might be very frequent, but the nature of injuries are going to be little ticks and nothing severe is going to happen? Identify these corrective actions. Look at the severity of the incident and the frequency that you expect them to occur. The ones that maybe are most frequent are the easy ones and may be insignificant effects, slight cuts, maybe occasionally you're going to need stitches. Those are easy ones that you may be able to take care of and get rid of a lot of injuries from occurring, but you may have situations out there where the major effect might be, event could occur 10 times every 2 years or 100 times. But you do this task 100 times, and every 100 times the event occurs, an activity. And there's, in this case here, there's a high possibility that if it does occur, the 1 out of 100, a serious death or injury could occur, a fatality. 1 out of 100 is too frequent when you have that serious type of event. You have to look at that and say, can we accept that as acceptable risk, and look at it that way. And again, I say early intervention. Early intervention may only involve first aid. You need to work with your specific medical provider. If you're working with an outside company, when you're sending your people to there, bring the people into your site. Make them aware of the nature of the hazards that you have. Make them aware of what you do at the site. Let them see what you do. Invite them in. Because the better they understand your hazards, if a person comes through, the better they're going to be able to ask questions and maybe phone you before they write your letter of restriction, a prescription of restriction, or other things. They may contact somebody and say, what is the requirements to do this job? You know, I just want to make sure to understand that you have some specific requirements. Your job descriptions specify certain activities, and they may eliminate writing prescription, the restrictions. Or in some cases, you may talk to the doctors. Hey, if a person comes in and we can get by, if he doesn't need prescription pain medication, prescribe him over the counter. Prescribe him the 200 milligrams of Motrin, 400 milligrams of Motrin. Don't prescribe prescription medications. In many cases, having a medical professional organization intervene with injuries or illnesses with treating physicians to assist or consult with the treatment could prevent a case to become recordable. And again, if you do, and like I said, in cases like this, request the use of over-the-counter medications at non-prescription dosages and treatment plans eliminating surgeries, extensive PT are possible. You may find that the person doesn't need this. And significant reduction of these costs will also benefit your bottom line, because now you don't have to replace these people on the job. If you reduce the number of injuries, you keep them working, prevent injuries from occurring. You still need to manufacture, you still need to make the product, you still need to do the work in the construction, but you may need to pay the individual money to be on workers' comp, as well as paying somebody to do, the second person to do his job. So if you can reduce your total number of injuries, keep people safe, and reduce accidents, you can bring about a significant reduction in your workers' comp costs, and also the need for additional costs as more employees to do the same work by having to bring in and pay people overtime or hire new people to come in to do the job. And again, these are just some things that I talked to you before. All right. On that matter, let me answer N. I think we may have gone over a little bit my 75. Initially, I was hoping 75 minutes. If there's any questions that you have concerning record keeping or any of the issues that I addressed today, I would like now to bring them up. I have some questions here that I just kind of put in here for your information, and these are coming generally, again, out of the letters of interpretation that OSHA has. And I like to open it up to the people in the audience if you have any questions, and I'll be happy to answer. If you don't have any questions, please forward them on to, and they'll forward them on to me, so I can then in turn to Vicki, so that I can then, and she'll forward them on to me, and I will get an answer to you if I don't have the questions. So in the meantime, go ahead, Vicki.
Thanks.